Good morning. You are watching Sunrise at Sea this morning, and you're right in time for wellness with me, Sandra Kopp, this morning. I'm at Bethany Women and Family Clinic, and I'm back to see the good doctor, pediatrician, Dr. Helen Namusoke. Good morning, doctor. How are you?
Fine, Sandra. How are you?
It's good to see you
How
again.
is CTV?
CTV is good. It's good to see you again.
Thank you.
And this time I am back, and I would like us to talk about viral infections in children. These are so prevalent in children, and we would like to know, why do these infections happen? How can we deal with them? Is it something normal? Because some mothers think like, oh my gosh, what's wrong with my child? Every time viral infection. So what causes viral infections in children?
So to start with, viral infections are the commonest infections we see in children, especially under 5 children, and most especially in their first year or first 2 years of life. Most of the time, they are viral infections. Unfortunately, they cause a lot of discomfort, not only to the mother, but to the child themselves, because they tend to present with really very high fevers. Yes. Commonly, they are airborne infections. Okay. Yes. One has a cold in the house, or you visited somewhere where someone has a cold, a common cold, that is flu and cough. Yeah. Then a child can easily pick it up. Yeah. Sometimes hygiene issues, for example, where a child gets into contact with stool, they can get a diarrhea-related viral infections or vomiting. You know, children are very tricky. They're mouthing everything they come across, especially around.
Sometimes, like if you're changing the child, and once you wipe the child, then they're busy touching themselves.
Exactly.
They
put in the mouth.
Some people don't even wash their hands.
Yes, or if the mother is not hygienic enough, they are not washing their hands often, they can easily transfer these viral infections to their child. Yes. So they can present as either high-grade fever, they can present with a cough, flu, sometimes an ear infection, sometimes a throat infection, sometimes diarrhea, sometimes they can present as vomiting, skin rash, or just general discomfort. Yes.
Oh wow. So what should you do, like if a baby is getting a fever, a very high fever, and it's late at night, you can't rush to the hospital, maybe the hospital is far, and these days, you know, curfew and everything. Yes. What do you do at that time? What is the first thing that you should do?
So our mothers have always done it, you know, they will undress. I would advise that you undress the baby to begin with, and then get a sponge and do a warm wipe to the baby.
So it's a warm wipe, because many people say you do very cold water.
No. Imagine you coming from a very high temperature to a very low temperature. It shocks the body, and it can actually disturb the body functioning, and sometimes the children can even convulse. So I would advise a warm, lukewarm. You get lukewarm water and give the baby a tepid sponging from head to toe. Sometimes you can give a baby a warm bath. It can help control the temperature as you move to the facility, and you keep monitoring. And these days, mothers are very bright. They always have thermometers on hand, where they can monitor the baby's temperature. It's not like our mothers who use to feel by their palm, and you know, so they can measure. So a normal temperature range is from 36 degrees Celsius to 37.3 degrees Celsius. So anything going above 37.5 degrees Celsius is really abnormal. Yes, so the earlier you begin tackling this temperature sponging before it gets out of hand, the better, as you move to the nearby facility.
And what are the must-haves medicine to have at home? What kind of pain relievers should you have on hand?
I wouldn't say must have, because very often we see mothers use paracetamol. Yes, it helps the child, especially for some children who get to convulse with a high fever. It helps them control the temperature. But sometimes the mother doesn't know the right dose to give of the paracetamol. And you know, overdose of paracetamol is quite lethal. It can lead to death. It can lead to liver damage and eventual death. So that's why I'm a bit skeptical about the must-have of paracetamol, unless if you've consulted a clinician to guide you on the dosing of the paracetamol. Yes. Other than that, I wouldn't advise you to go and just get it off the counter and begin giving your child.
To talk to a pediatrician?
You need to talk to a doctor to advise you on the dosing.
And also, like, some people get the dosing right, but then the number of times to give, because someone can give every 2 hours to a baby,
or
3 hours. If they are a bit not comfortable, they just keep on.
Depending on the dosing we are giving and severity of the fever, we commonly give every 8 hours. Sometimes when it is too much, we can go up to every 6 hours. And if it is too bad, every 4 hours. And the more frequent we give it, the lower the dose we give at a particular time. Okay. Yes. So we have a maximum dose we should give within 24 hours. So sometimes we can divide that dose to every 8 hours, or every 6 hours, or every 4 hours. Yes.
So what would you advise parents out there? What kind of habits should they adapt in a home or when going out to be able to stay away from these viral infections, like to keep them at a minimum?
Okay, to keep the infections to the minimum, first we need to build the immunity of the child, because sometimes it is inevitable. You can't say you'll not go to a church. You can't say you'll never go visiting, because you're protecting your child from some of these infections. So the main thing to do is to make sure that your child has a very good immunity, and there's nothing that builds a child's immunity like feeding them.
Feeding them with...
so I would advise mothers to exclusively breastfeed their babies for 6 months. Yes, now you'll say we have to go to work. Yes, you can still breast milk feed your child even when you're a working mother. So I would advise them to feed on the breast when they are home. If they have to go to the boardroom and look for some monies, then they can express the milk, keep it in the fridge, let it be warmed at the time of feeding. It is very safe for a baby once the hygiene is very good. Breast milk is the most balanced feed you can ever give your child, and it has the right quantity and quality of nutrients to build the immunity for your child. So I'd advise all mothers to make sure that their children take breast milk up to 6 months, at least 6 months, and then they seek help with weaning and feed the right nutrients. For example, a child in their first year, they need a lot of protein and carbohydrates because they are growing very fast to build their body. Yes, so they need bodybuilding feeds. That helps to build immunity, so that even when they're in contact with some of these infections, their bodies can fight and they don't have to present with symptoms. And then hygiene is very, very important. Hand washing, the basic thing to do. The older children, how do they sneeze? You can sneeze under the elbow to make sure that you minimize spread to the little ones. And then tissue, I'd advise to use tissue instead of hankies, because so that you can just dispose them off and you don't reusing. With the reusing, sometimes the children are playing and they're throwing it everywhere, so you're spreading infection. Cleaning surfaces within the homes to make sure that they are home, because the little ones are crawling, they're mouthing everything. And to only go to the crowds if you must. Absolutely. With the little ones. Yeah, you try to protect them. Yes.
And cutting their nails as well, right?
Yes, yeah,
Because
yes.
you find them, they play with soil, they do this,
Exactly.
they do that.
And also immunization. Yes, to follow the immunization schedule as advised by Ministry of Health and WHO to the adults to prevent some of those severe infections.
What of things such as the multivites for children? Is that like cod liver oil? Does that boost their immunity as well?
Yes, it boosts their immunity to some extent, but I wouldn't say that they should take them to the routine. If you feed your child very well, then you don't need to use the supplements.
Just go natural?
Yes.
They make them from that stuff
Exactly, yes.
Well, thank you, doctor. Thank you for such an insightful talk. At least
Yes.
now I know there was so much, like I didn't know what causes the viral infection.
Yes, and beauty with viral infections, most of the time they clear on their own.
Okay. So
Yes, so we most of the time do symptomatic management. For example, if a child has a very high fever, we try to control the temperature with either paracetamol, Ibmex, or any other things we can use to control the temperature. Or if they have a common cold associated with it and they have really congestion, we give a decongestant for the nose. Sometimes they have diarrhea, we give them zinc, ORS, to try and rehydrate them and build their immunity with the zinc to prevent further diarrhea episodes. But otherwise, most of the time, they clear on their own. However, sometimes they get a secondary bacterial infection on top of the viral.
From the viral infection?
Yes, because what happens, a viral infection can lower their immunity. And when the immunity is low, they are susceptible to other infections. So sometimes a bacterial infection comes in. That's why if a child has a fever for 1 or 2 days at home and you feel they are getting weak, frequent stooling coming with it, I would advise a mother to seek medical help so that a clinician can tease for you whether it is just
only a
viral infection or it has escalated. Yes. Yes.
That's very insightful.
Thank you.
That's very insightful because most of the times, like, some people would say, no, it's a viral infection, just make sure they drink a lot, they should rest, and yet sometimes it has turned into something else.
Yes, and actually sometimes when they have these viral infections, their feeding, their appetite tends to go low. You know, when you're unwell, you're sick, they are not feeding well, so yes, it is not wrong to say that they should feed them frequently because they are taking little. So little by little makes a number, makes a bundle. So I would still advise them to feed the little they can take more frequently so that they need the immunity more than before.
Well,
yes.
Thank you, doctor, for that. Thank you so much.
Welcome.
I hope you have been listening out there what to do and how to mitigate these viral infections. And remember, if it goes untreated for babies, it could actually turn into a bacterial infection and you could just be dealing with something totally different altogether. Well, you heard that from the good doctor, Dr. Helena Msoke from Bethany Women and Family Clinic here in Butavika. Don't go away because we have quite a program lined up for you. That was all on wellness this morning with me, Sandra Kopp. See you in a bit.